I'm Dr. Angelique Coetzee, National Chairperson of the South African Medical Association and a general family practitioner. For the past 33 years, I have extensive knowledge in primary healthcare, especially around COVID, as in our third wave with Delta, I have personally examined and treated more than 600 patients face-to-face, not on any other platform. And about 3.5 weeks ago, I detected new symptoms, clinical symptoms of patients coming in, and realized it can't be Delta anymore, it must be something else. I also alerted our advisory committee and different clinical pictures. Also, the lab in the background detected on the PCR there are a S gene missing on the PCR tests, and so our scientists started to look into it, and that's how we realized we have COVID-19 Omicron virus going around. It took our scientists a few more days before they could come up with the sequencing and said that this new variant's got more than 30 protein spikes, different mutations on this protein spikes, and therefore a variant of concern. When it was announced, the whole world then started to close, especially UK started first to close their borders to South Africa because they were afraid of this variant. And it is now our 4th week into dealing with this new variant. And for now, we can say that at primary healthcare level, most of these patients are having mild disease. Yes, we do see breakthrough infections, regardless whether you are being vaccinated or being vaccinated and had Delta before. However, again, at primary healthcare level, it's mild disease. What we have seen is that the unvaccinated people, the clinical picture is very much similar to that of a fatigue or not having energy, a headache, a severe headache, as well as what we call body aches and pains or muscle pain. We also saw that the unvaccinated people, the intensity of the headache as well as the body aches and pain are much more higher than those of the vaccinated people. So far, we didn't really admit anyone from the primary healthcare sector in Gauteng. Patients admitted to hospitals. If you look at our hospital stats, it looks as if it is very high for hospitalization, but most of those patients are actually incidental findings and not being admitted for COVID themselves. And we will, going forward, see what happens in ICU. Our ICUs are not overburdened at this stage. Our ICUs, there's a lot of patients in ICU with motor car accidents, other related diseases, but not related to COVID. And then when they are tested, they would be found positive, but that's not the primary reason why they are there. And we see that the recovery rate of these patients are quite fast. It's about 5 days since we make the diagnosis. You can make the diagnosis on a PCR. You can also make the diagnosis on a rapid test if you do the rapid test within the first 5 days. We have seen our cases the past 24 hours. There was a report out there that our cases increased a lot. Unfortunately, there was backlog of our cases. So they reported 37,000 cases yesterday, but it was due to backlog, and the new cases yesterday was actually 18,000. So with a positivity rate of 28,000, because only 62,000 patients were tested over the weekend. So we know that on Mondays, normally the values will be the numbers would be a bit less. And then by Wednesday, we would have a better indication. But for now, our ICUs, majority of patients lying there is not related primarily to COVID-19. Children, also there was this feeling that maybe the children are being admitted, but more admissions on Omicron, that they are more sicker on Omicron. That's not the clinical picture that we are seeing. Again, those children that has been admitted was not primarily for COVID-19. or Omicron. We still need to get from our labs. The labs needs to distinguish between Omicron and Delta so that we can understand at ICU level what needs to be done. Whether it is Omicron or Delta patients lying there, we don't know. But at primary healthcare level, the clinical picture is clear, and we know that we are seeing Omicron at primary healthcare level. Also, these patients, as I've said, recover quite fast. We haven't seen the need for any oxygen. Most of these patients are in any case at home, and as I've said, within 5 days, they are recovering. I hope this helps and assists. Also, the medication that we are prescribing to the Omicron patients due to the headache and the body aches and pain is predominantly Panado with a paracetamol with ibuprofen. It actually works quite well for the headaches for those patients that can tolerate it.